Hi guys, let's learn about the clavicle. So the clavicle is your collarbone, and we all have two clavicles in our bodies, the left and the right clavicle. The clavicle is a subcutaneous bone. It is a long bone. One of the classifications of clavicle is that it is a long bone. No medullary cavity. The medullary cavity is absent in the clavicles. The clavicle bone has two primary ossification centers. It is a membrano-cartilaginous bone. Let's talk about the side determination of clavicle. The medial end of clavicle is the broad end and the lateral end is the flattened end. Here we can see the clavicle bone. This is the medial end. The sternal end is the medial end and the acromial end forms the lateral end. The notes tell us that the medial two-third of the clavicle is convex in shape and the lateral one-third is concave. Now here in the diagram of clavicle we can see that the medial end, so this is the superior surface and this image gives you the inferior surface, and in both the surfaces we can see that the sternal end or the medial end is convex. The medial two-third of clavicle is convex in shape and the lateral one-third or the acromial end is concave in shape. Let's talk about the features of the clavicle bone. So first of all we have the shaft. So this is the shaft, and every long bone has two ends and a central shaft or the body. So talking about the shaft first, lateral one-third, the shaft can be divided into lateral one-third and medial two-third. Now the lateral one-third of the shaft is flattened and consists of two surfaces and two borders. As you can see in the diagram that the lateral one-third, the acromial end is the flattened end and it consists of two surfaces. Now superior surface and obviously the inferior surface and two borders. So here we have the, if we look from the superior aspect, this is the anterior border of the acromial end or the lateral one-third of the clavicle, and this is the posterior border. So again coming to the notes, the lateral one-third consists of two surfaces and two borders. The superior surface is smooth and the inferior surface is rough in texture. The superior surface is subcutaneous between the attachment of deltoid and trapezius. Now these two are the muscles that are attached to the lateral one-third of the clavicle. The inferior surface consists of two very important features of clavicle, which are the conoid tubercle and the trapezoid ridge. Now let's locate them in the diagram here. So here is the lateral one-third or the acromial end of clavicle, and here we have the conoid tubercle, and here you can see, so this is the conoid tubercle, and here this line or this ridge like structure you can see, so this is the trapezoid line or the trapezoid ridge. Got it? And on these two features we have got the attachment of coracoclavicular ligament. Now let's discuss the borders. So as we discussed earlier, the lateral one-third of the clavicle consists of two borders, anterior and posterior border. On the anterior border, we have the origin of deltoid muscle. Where exactly? On the deltoid tubercle. So the deltoid tubercle is not really mentioned here in the diagram, but we know that on the anterior border, which means here, on the anterior border of the clavicle, of the lateral 1/3 of clavicle or the acromial end, we have the attachment of deltoid muscle. And which attachment? The proximal attachment, which means the origin of the deltoid muscle. Proximal attachment means origin and the distal attachment means insertion. And on the posterior border, we have the insertion to trapezius muscle. So here, this is the posterior border, and here we have the insertion or the distal attachment of the trapezius muscle. Now let's talk about the medial 2/3 of the shaft of clavicle. So the medial 2/3 or the sternal end is circular in shape, or it is like a broad end which is circular in shape, and it consists of 4 surfaces. Again, you can see in the diagram that the sternal end, so this is the broad end. Here the end appears to be flattened, and the sternal end or the medial 2/3 is broad and circular in shape. Now again, it has got 4 surfaces. The superior surface has got the attachment of sternocleidomastoid muscle. The inferior surface has got the costal tuberosity and the subclavian groove. So in this picture we can see that on the inferior surface, this picture shows the inferior surface of the clavicle, and here we can see that the inferior surface of medial 2/3 of clavicle has got 2 very important features: the costal tuberosity, which is here, basically this is the costal tuberosity, and the subclavian groove. Here, this groove is called the subclavian groove. Now on the costal tuberosity, we have the attachment of costoclavicular ligament, and in the subclavian groove we have got insertion of the subclavius muscle, and the subclavian groove also forms the margin of the clavipectoral fascia, and on its lateral end we have got the nutrient foramen. So let's say if this is the subclavian groove, right? So here on the lateral end we have got the nutrient foramen. And since there were 4 surfaces, so we discussed the superior and inferior, and now the anterior surface. Obviously the anterior surface has got the origin of the clavicular head of pectoralis major muscle, and the posterior surface has got the origin to sternohyoid muscle, and the lateral part forms the lateral part of the posterior border of medial 2/3 of shaft of clavicle, forms the boundary of the cervicoaxillary canal. Got it? Now let's talk about the joints that are associated with the clavicle bone. So on the sternal end, we have the sternoclavicular joint that exists between the sternum and the clavicle. It is a saddle type of a joint, and the movements that exist at this joint are elevation of upper limb, And secondly, elevation via flexion with rotation of clavicle around its longitudinal axis. The blood supply to sternoclavicular joint is provided by the internal thoracic and the supraclavicular arteries. The internal thoracic artery and the supraclavicular artery are responsible for the blood supply of the sternoclavicular joint, and the nerve supply is given by the medial supraclavicular nerve. The ligamentous support at this joint is provided by the sternoclavicular ligament, interclavicular ligament, and the costoclavicular ligament. The sternoclavicular ligament means that it is attached to the sternum and the clavicle. The interclavicular ligament is attached between the two clavicle bones, left and right clavicles, and the costoclavicular ligament means that it is present between the ribs and the clavicle. Now, on the acromial end, we have got the acromioclavicular joint, which is a gliding type of a joint, and the blood supply of this joint is provided by the supraclavicular artery and the thoracoacromial artery, and the nerve supply is given by the branches of axillary nerve, lateral pectoral nerve, and thirdly the supraclavicular nerve. The movements that exist at the acromioclavicular joint are protraction of scapula, which is supported by the serratus anterior muscle, retraction of scapula, which is supported by the rhomboids, which means the rhomboid major and rhomboid minor. There are two rhomboid muscles, so yeah, both of the rhomboids, major and minor, and the fibers of trapezius muscle. Elevation of scapula, which is brought about by the trapezius muscle again. The depression of scapula, which occurs naturally because of gravity. The upward rotation, which is brought about by the trapezius and serratus anterior muscles, and the downward rotation, which is brought about by the latissimus dorsi muscle. And finally, the ligamentous supply or the ligamentous support at the acromioclavicular joint is provided by obviously acromioclavicular ligament attached to the acromion process and the clavicle. Secondly, the coracoclavicular ligament, which is present between the coracoid process and the clavicle. So this was all about the clavicle. Thank you so much for watching. I hope you found this helpful.